Good evening, everybody. I think we are now live on this last but one Facebook Live event from NRAS of 2022. I can't believe that we are galloping so fast towards the end of the year. I'm Ailsa Bosworth. I'm NRAS's National Patient Champion, and it's a pleasure to welcome you all to our Facebook event tonight, which is going to be on the very important topic of supported self-management. And you've got the Scottish contingent tonight. So I'm delighted to be joined by our friends from Fife in Scotland. We have Janet Harkess, who is the Rheumatology Principal Occupational Therapist and Self-Management Lead at Fife. Welcome, Janet. And she's joined this evening by her colleague, Trudi Dickson, who is clinical psychologist within the Rheumatology and Psychosexual Service at Fife. So welcome to you both. I'm really delighted that you could join us this evening. It's a really important topic. And Janet and I go back many years. We've done lots of work on self-management together. Janet was one of the first units in the UK to run our 6-week self-management group face-to-face program. And I did a great job with that, and has also last year been piloting an online group program for us. So you're both very welcome. And I'm going to start off tonight. Also, I just want to mention we've got our fantastic digital media manager, Anita Massey, on the line. She's going to be our tech support tonight and keep us all in good order and to time, I'm sure. So I'm going to just start off, if I may, by talking about why self-management is so important, why I practice it and have learned so much about it over the last 20 years since starting NRAS back in 2001. I've lived with inflammatory arthritis for 43 odd years, and I think looking after yourself well is what is behind supported self-management. And I think this is crucial because there is no area of your life that this disease does not impact. It affects you physically, emotionally, mentally, and you have to deal not only with the debilitating symptoms, but also the burden of the treatment. Its impact on your life is profound, and also on that of your closest family and friends. So being a good self-manager with the right support helps you adapt to living with this disease in a balanced way where you are still you and you feel in control of your life. Because we're an evidence-based organization, I thought it would be quite a useful idea to just look at what does self-management mean? What is its definition, if you like? And one of the things that I was involved in back in 2019 to 2021 was the development of EULAR guidelines on inflammatory arthritis self-management strategies for health professionals. And we published the recommendations for this last year. So let me just read you what we define self-management at. There are a variety of definitions, but we decided to go with the ability of the individual to manage symptoms, treatment, lifestyle changes, and psychosocial and cultural consequences of health conditions. So that's quite a lot of stuff just in that single definition. And we always refer at NRAS to supported self-management, because when you hear the word self-management, it's easy to think, well, does this mean I'm going to be on my own managing this disease? I'm not going to have the help of my team or whatever. And of course, it's the complete opposite. Supported self-management is about managing yourself, but with the right support from the right people or person at the right time. And that might be your rheumatology team, it might be your family, it might be your work colleagues, it might be NRAS or another relevant patient organization or another non-health related organization. It's whoever you need to help you manage your disease successfully so that you can look after yourself, enjoy your life, enjoy your work, and do all these things to the best of your ability. I can remember the first 20 years of living with RA were a complete blur to me of endless hospital visits. I can't tell you, Janet, how many splints I had, splints for my wrists, splints for my legs, all sorts of things, resting splints, night splints, and steroid injections, operations, and real struggle. And no one taught me about self-management and what this meant, why it was important. I don't think it was a thing back then, 43 years ago. And when I started NRAS in 2001, I'd already been living with RA for 20 odd years. And so I kind of had muddled along, got through it for 20 years and sort of thought that I knew a lot about it. But if somebody, you know, had said to me back then, do you know how to self-manage? I think I probably would have said yes, like a lot of people I speak to and say, you know, how do you self-manage? What do you do? And people, you know, say, yes, I self-manage. But actually, I don't think they always do. I think there's so much you can learn about this disease because it is complex. The medications, the treatment regimens and so on, they're complex. And I think self-management is something that doesn't come to you. You don't sort of get a bolt of lightning one day and suddenly you can self-manage. It's something that you have to learn. And it's different from self-care. You know, self-care is when you stick an elastoplast on a cut to stop it from going septic, or you clean it with antiseptic or something. That's self-care. You take your hand out of the flame because you'll burn yourself. Self-management is different because you have to think about planning your life. You have to learn about your disease, learn about the medications, and because self-management itself and the disease have multiple components, it's not straightforward. And I'm still learning. I've learned so much since starting NRAS, and so many things that I have now incorporated into my own lifestyle that I don't think about anymore. But I had to learn all of that. And I've had to learn about my disease, learn about the various treatments. Having gone through most of the biologics, there's a lot to learn about. And I think sometimes it's easy to kind of feel overwhelmed by everything that's happening to you. And there are times when you kind of want to stick your head in a bucket and think, well, I just want this to go away. I don't want to know about this anymore. I just want the doctor to tell me what to do. But actually, getting more involved in your treatment, taking part in shared decision making, learning about your drugs, learning about the fact that you need to take your medication as prescribed and regularly, and all these things are things that you do need to take on board. And fundamental on that is education about your RA. And we're living in a climate at the moment when health professionals are with their backs to the wall. You've got so much on your plates because of COVID, because of staff shortages, because of patient backlogs, because of COVID and so on. And so the amount of learning and education and so on that is now coming from most rheumatology units is probably less than it used to be. A lot of hospitals used to run in-house self-management programs for the newly diagnosed with different members of the multidisciplinary team taking group sessions and so on. I think that's, we've seen that becoming less and less and less. So the onus is more on the patient to find out about their disease, to learn about their disease, and to take on, responsibility, if you like, for managing their disease as well as they can. One of the things involved in that is asking questions and feeling comfortable and confident to ask questions when you are having a consultation. And I think that, you know, one of the things that I've also found over the years, talking to many people around the UK about their disease, a lot of people don't know whether they're seropositive or seronegative, whether they're anti-CCP positive or negative. And these things do matter because they can influence which treatments might be better or worse for you and so on. A lot of people also don't know what the drugs are that they're on. They can't remember the name of them and so on. All of these things I think are really important to as a patient to take on board and to find out about. I've also seen a lot of changes in the last 20 years. We've moved away from this sort of paternalistic role of medicine. And it is now much more about shared decision-making, with the patient taking a more equal role on decisions when you're talking about treatments and options and things in your care. And that takes a lot of confidence sometimes for people, because, you know, you don't want to kind of say no to a health professional, or say, well, actually, I don't like the sound of that, or, you know, people tend to sort of go along with what's being told to them and what treatment options are being put. And it's important to ask questions until you feel confident that you understand the answers and you know what the options are for you. I can't tell you how many times I have wished in the past that I had asked more questions or found out more, because I would have made different choices and I would have had different outcomes. And, you know, I've lost most of the sight in my right eye. Had I known to uveitis as part of the disease, had I known now what I know about uveitis, that might not have happened. But, you know, these are some of the reasons why it is important to know what's happening to you and what's being offered to you and what that means for your care and your treatment. The other area that I think is really important for patients to be aware of and to manage in a way themselves is comorbidities, other conditions on top of your RA. People with RA often have another condition in addition to their RA. For example, we're more at risk of heart disease. We're more at risk of osteoporosis. A lot of people with RA have diabetes. And so, you know, that puts even more onus on us to understand and manage these additional things and manage the multi-medications that we have to take. But if you know that you're more at risk of heart disease, knowledge is power. You can then have in your control the modifiable risks with heart disease that you're in control of. So things like BMI, weight, exercise, not smoking, alcohol intake, your cholesterol, lipid levels, and so on, and your blood pressure. All of these things are within your control to do something about. So when I go to my GP surgery for my regular blood monitoring, I ask the nurse to take my blood pressure, so I know what it is, and she writes it down in my medical records. I make sure I get my vitamin D levels tested once a year. A lot of us are deplete of vitamin D, especially in the wintertime. I make sure I get my lipids, my cholesterol levels tested once a year, so that I can have a conversation with the GP. Do I need statins or don't I need statins? You know, these are all things that if you don't look out for these, nobody else is going to be responsible for making sure that these things are looked at on a regular annual basis. So, you know, an osteoporosis, make sure you don't have, you know, mats that you're likely to trip over and fall in the hall and that sort of thing at home. Make sure that you keep as mobile as you can. Do some exercise. I mean, I have to say exercise is something that I really, really struggle with because of pain and damage in my feet and ankles. But these are all things that are within our control. Getting our blood monitoring done regularly, not sort of forgetting to go or skipping out. I mean, I know sometimes during COVID, it was quite difficult to get blood monitoring done, but it's important that taking your meds regularly, getting your blood monitoring done, these are all things that will help you understand how you are and so on. Exercise, I'd just like to come back to briefly because it is really important, and we lose, when you get RA, we lose muscle mass quite quickly. And I know that I've lost a huge amount of muscle mass, and I struggle going up and down stairs and things like that. I know I need to do more strengthening exercises and resistance exercises. I've been shown how to do this. I've got the bands and so on. I need to get myself into a headspace where I need to get started on doing that stuff again, because I did do it last year and it made me feel better, and I could feel the difference in my balance and my strength, and I got out of the habit again. So, you know, motivation to do exercise is hard, but if you can find something that you like doing with a buddy or a friend, then, you know, these are good things to do. Adherence to medication, really, really important. That would be one of my strongest messages to anybody newly diagnosed. Take your medication, because if you don't, you're likely to flare, and it's likely to have a negative impact. Diet is another area, massive area, lots and lots of interest in diet on our Health Unlocked website. I eat as good a diet as I can. I consciously eat things that I know are good for me. I consciously do things like have 3 or 4 alcohol-free days every week, except when I'm on holiday, perhaps. So I try and I keep my alcohol within government guidelines. I used to smoke, but gave that up 40 years ago, because smoking actually increases your risk of getting RA, and it also interferes with the absorption of the medication. So, you know, there are other reasons, not just for heart and lungs, to stop smoking. Preparation for surgery, if you're going to have surgery. I can't tell you how much work I've done, having had 4 foot and ankle operations where I was not weight bearing for 3 months at a time. I'm an expert now in things like female urinals that you can use sitting down and so on. All of this stuff I had to learn myself. Nobody, actually, it was a physio. It was a physio in the hospital who said, you know, have you heard about one of these? I said, no, it sounds excellent. Just what I need. Where do I get one? So all these things, you know, I've had to learn over the years. And so we spent a lot of time in NRAS trying to produce resources and services and programs in different formats that will help people learn all this stuff as easily as possible. And probably Smile is our latest e-learning program where we provide this kind of information, but in a nice, easily absorbable way. Anyway, I'm going to shut up now because I've blabbered on for far too long. And I'm going to hand over to Janet, and Janet and Trudi are going to tell us about some of the fantastic work that they're doing with supported self-management pathways in Fife. So over to you guys.
Thanks, Ailsa.
Thank you, Ailsa. And just to say thanks very much for your warm welcome. And Trudi and I are delighted to be here. We've been, as Ailsa said, her and I have known each other for a long time, and NRAS has been going as long as I've been married, Ailsa. So that's quite a long time. That 2001, I remember when you started because I got married that year, and it was joyous for two reasons. So we're going to present to you what we've been thinking about in Fife for quite a while. We probably started thinking about the importance of self-management. It's been, as Ailsa said, it's been a concept that has evolved over the years, but we really started thinking about it 2015 and 16, and then we came up with a pathway in 2019, and then we started it in earnest in 2020. actually during the pandemic when our backs were up against it, but we felt it was even more important to implement it because of the pandemic. And we forged ahead despite everything that we were going through. So I'm going to hand over to Trudi, who's going to speak about the development of the pathway. The psychology team have been hugely influential in getting this off the ground, and I've taken over as the self-management lead. So we work closely together to deliver the pathway.
Great, thank you, Janet. Hi everyone, my name's Trudi Dickson. I'm a clinical psychologist with Fife Rheumatology Service, and yep, as Janet was saying, that what we'll do is go through some slides that helps explain a bit about the development of this pathway. Okay, next slide, please, Anita. Thank you. Okay, so why did we redesign our pathway? You can see from the slide there, in 2010, the Scottish Government released a self-management strategy for long-term conditions. So the new pathway was developed based on a number of recommendations in the report. And the pathway also fits really well with local NHS 5 strategy that highlights supported self-management as a priority for people with long-term conditions. We also redesigned the pathway with principles from realistic medicine in mind that focuses on the patient being at the centre of care and decisions about their treatment, and takes into account the personal preferences of the person. And you'll see from the bottom of the screen what matters to you. We're committed to the personal outcomes approach, which holds what matters to patients centrally in the assessment process, and the new pathway fits really well with this as it takes into account priorities and what goals are for people. Okay, next slide. So more recently, from EULAR and the recommendations in the GIRST report, they both reinforce the many benefits of self-management interventions and the importance of embedding these in the routine care for people with arthritis. Okay, next slide. And that we have, I suppose there's certain key elements in our pathway, and one of which is the integration of biopsychosocial principles. So this ensures that every person diagnosed with inflammatory arthritis receives a full biopsychosocial assessment and access to tailored information and treatment around issues that impact their quality of life. Collaboration and partnership is also another key element of the pathway. We've increased our level of collaborative work as a multidisciplinary team, particularly through our virtual team meeting, where we share decisions about the ongoing care of patients and interventions offered to them. And the model also promotes collaborative work with patients and allows the person to be an active participant in their care rather than passively receiving care. We provide high quality, sustainable service that's directed towards the needs and priorities of patients themselves. And our third sector links are also really important in developing the pathway, and certainly most notably the online self-management group that was jointly created with NRAS. We're committed to ongoing service development and have integrated evaluation measures and continue to audit and review options for research opportunities as we move forward. We also provide consultancy, training, supervision and advice to other services wishing to take on a similar self-management model, because that's important to us so that we can maximise the amount of people that can benefit from the work that we've done so far. Okay, next slide. So it's important we begin with the end in mind. And so here you can see there's two checklists for people who may go on to our open access as part of the pathway. And you can see there's different criteria as well that looks at self-management. Okay, next slide. So we use a matched care model of service to ensure that we meet the patient's need for support at the right level for them. So this means we offer every patient the opportunity to engage with the right person in the right context and within the time frame they need. So for all patients, a comprehensive self-management assessment is available, and people are provided with written or digital information to support their understanding of their condition, how to manage it, and are signposted if needed for further support. You can see from the diagram for other patients that require more structured input, there are group-based interventions that include self-management programs or our fatigue management group, and there's also the NRAS online self-management group. And for people who are looking for support in the form of one-to-one, they can be referred to individual self-management interventions. And for those with more complex needs at the very sort of top of the pyramid, they might see a qualified member of staff in psychology or physiotherapy or occupational therapy. That might be necessary and offered where appropriate. Okay, next slide. So you can see this is a diagram of the pathway, and it shows the process from the point of diagnosis, where people have received an information pack that includes direction to Fife Rheumatology website. People can access videos to help familiarise themselves with the multidisciplinary team and the idea of self-management that Ailsa was talking about. And then during the pre-assessment phase, we would contact the person for a pre-assessment telephone call, and this screening stage also allows us to identify if there's any more urgent care requirements. And at that time also, the person would be contacted by a rheumatology podiatrist to assess foot health, and a separate medication counselling sessions is also offered with a rheumatology nurse specialist. And then further down the pathway, people are offered a self-management assessment via near-me video call. And it's at this stage the healthcare professional and the patient would agree on a course of action using that sort of matched care model that would support their needs. And then the patient would go on to access any support that they've been referred for and later brought back to our multidisciplinary team meeting, where their interactions are discussed and reviewed and any further support arranged. Okay, next slide, please. And this is an example of our new patient questionnaire and also the self-management assessment screening questionnaire. So it gives you an idea of some of the information that we ask about in terms of the person's experience and what's important to them. So we really get a good sense of that person and what their support needs might be. Okay, next slide. So our multidisciplinary team virtual clinic, this takes place 5 months post-diagnosis, and this allows the team to build a really detailed picture of who the person is and where they are in terms of their self-management journey. So prior to the meeting, team members complete the case discussion form that you can see on the slide, and this allows members of the team to report any contact and engagement they've had with the person. So this allows us to develop a sort of shared decision making and structure a formulation of the person's difficulties. And it can also highlight areas where they are managing well, but also areas where they might require further input. And not only this, that the meeting, I suppose, allows us to form a clearer picture of the individual and how we can best offer support to meet their ongoing self-management needs. So this ensures the patient's seen and reviewed by the right person at the right time and in the right context relative to their specific needs. Okay, thank you. Next slide. I think I might be passing on to Janet.
Yeah, thanks, Trudi.
Is that okay? Yeah.
Yeah, lovely, thanks.
Thanks, Janet.
So we felt it was important from the beginning of setting up the pathway to try and evaluate what patients thought about this pathway, what staff thought about it, and also to collect data to making sure that you know, patients were having good outcomes as well from making sure that patients' needs were being met. So our staff survey felt very much that there was comments from the staff survey saying there was improved patient satisfaction. It was an excellent tool for getting together and to use a team formulation for patient planning. People felt it was more patient-centred than it had been, than what we had been doing, and it was a better use of time in terms of efficiency, and patients felt more engaged in the process, which was great. We also asked patients 7 questions in a questionnaire, and most patients agreed or strongly agreed with the following statements. I know more about my arthritis than I did from when I was first diagnosed. I know what medication is used for and when to take it. I know where to go or who to ask if I've got questions about my health. I have what I need to manage my symptoms effectively. I have people I can talk to about my arthritis and its impact on my life. I know what a flare-up is and how I can manage it. And I feel more able to manage my symptoms now than before. So you can see the majority of people either agreed or strongly agreed, and you can see the percentages there. Next slide, Anita, thanks. So what do our patients look like in Fife? Well, most of our patients that we see are female, and most are in terms of smoking, and Ailsa mentioned how important it was not to smoke, particularly if you've got rheumatoid arthritis, and obviously it can lead to developing it. And our smoking percentages are the same as the national average. So our average patient is female, she's middle-aged, and if you think about all the responsibilities that people of our age, and I include myself in this, who may have parents to look after, who may have children or even grandchildren at this stage, and there's lots of demands that are put on people's life that still might be working. And you know, as Ailsa has said, rheumatoid arthritis can have a major impact in so many aspects of your life. So it's important to think what, you know, Mrs. Smith, who's 56 and who's in quite a lot of pain, and it's affecting her life in quite a few areas. And she's only sleeping, you know, 50% of the time, and she's got pain over 5 and out of 10 on average, and she's fatigued, and she's probably a bit overweight and really struggling to keep the weight off because she's not moving so well. So these are the typical challenges that the average patient faces. Next slide, Anita, thanks. Most of our patients have rheumatoid arthritis in our inflammatory pathway. Some might have early inflammatory arthritis that hasn't had the chance to develop into rheumatoid arthritis, and some of our other inflammatory patients have psoriatic arthritis or monoarthritis or other conditions like that. 39% of our patients are in employment, 37% are retired, 12% are unemployed, and if you think the national average is 3% unemployment in Britain at the moment, so that's probably 9% of people who have been medically retired and can't work because of their arthritis or comorbid conditions. 6% are off in employment but off sick at the moment. 3% are students and 2% and we don't have any data for. Next slide, Anita, thanks. Depression is a big issue in rheumatoid arthritis patients, and you can see from the slide on the left, we use a questionnaire in Fife called the PHQ-9, which 9 questions about your symptoms of depressive symptoms, and you can see quite a lot of people were normal, but also quite a lot of people, in fact, more than the people that were normal had mild or severe depression, and anxiety scores were reasonably normal. more normal than the depression scores, but still 2 to 3 times as high as the average population, as you can see. Next slide, Anita, thank you. Most of our patients would have no disability or mild disability, but 24% have moderate or severe disability. And that's just something to think about in terms of self-management. Thank you, Nita. And we also ask patients to let us know how confident they feel in managing different aspects of their life. So we ask them how confident they feel about their symptoms, managing that, their medications, their emotions, their social interactions and their relationships, and also their activities of daily living. And you can see again that roughly kind of 25% of people are either not confident at all about managing their condition, a little confident or somewhat confident, but the majority are quite confident or very confident. So again, it's that kind of a quarter of people are just struggling to manage their condition and for various reasons. And it's about supporting them in particular to really be more confident and empowered in thinking, how am I going to manage this with what I have to deal with in my life? And it's about us supporting them and NRAS supporting you. It's about different people in your life that are supporting you, whether it's your family or your friends or your vicar or your imam or whatever it is, to get as much support as you can to manage your condition. So we do feel that the key benefits are that as the doctors like to get in early with their medical treatment, because we know that the sooner the disease is controlled by the medications, the more chance it will go into remission, or the more chance it'll be managed better and it'll slow down the disease progression. We feel that if we really understand and get to know the patient as well as we can, to really understand what they need and at what pace, then early interventions to help you take control of your condition right from the start. And as Ailsa said, it can be very overwhelming, and we just take notice of feelings of that, and we offer the most appropriate support at the right time for you. And then we do feel it's been a collaboration between working with patients, working with each other, working with NRAS to provide the right support for the person. And as Trudi has mentioned, just getting it individualised to each person and not treating everybody the same. We've had to upskill, but we have had doctor shortages, as Ailsa has alluded to, in terms of difficulties in the NHS. And we've all had to learn more biological and clinical skills, and the nurses have done a great job, and so have the physios and even OTs and psychologists. We've all had to understand a bit more about each other's skills. And we do feel that we know our patients even better than we did, and it helps us to just plan our service to make sure that we are meeting the needs of the patients in the 21st century. Thank you, Anita. We also developed a rheumatology app, and the main aim of the app is to really digitalise all the hard copy information that we give out to our patients. And just a lot of patients, if they struggle to manage all the information, and a lot of people do have smartphones, either Android or Apple, and we created something that we just keep everything in one place, so patients can choose to either have a hard copy or Save the Planet if they've got a smartphone, and just read their information from the app. And there's lots of links to NRAS and Versus Arthritis and lots of other agencies that people can get fantastic information from. And just to finish off, I'm hoping, yes, I'm going to stop now, so you'll be glad to know. Here's Here's a few self-management hacks. So what about getting a stair basket, and it saves you going up and down the stairs all the time? You can put things in the stair basket, and that stops you from doing multiple trips up and down the stairs. The picture on the right is a picture of a wine opener. It's actually in its box and it should have come out. But this is an electric wine opener, so you just put it on top. You don't have to worry about obviously for people on methotrexate, you've got to be careful about your alcohol intake particularly, but you know, why not have a glass of wine on the odd occasion, and not strain your hands trying to get particularly if you're still into corks and not into screw tops. Using a diary can be a really helpful thing. We use, particularly for our patients who need to pace themselves, use a diary and just reflect on what you need to do and plan ahead and prioritize and look at how much energy you're using up for different activities. And going over to thinking about your work-life balance. Have you got the right balance between work, leisure, whether it's golf or whether it's playing bridge or whether it's going down to a cafe and having a chat with your friend? And remember that people are really important, that get the support you need. You know, if it's a relative or if it's somebody at work who can just be a listening ear. And then working our way around. This foam is fantastic for putting around anything that's a handle, whether it be your cutlery, whether it be your manual toothbrush or whatever. Different widths of foam. You can get it from building supplies, and it just, anything that's got a handle on it, you can stick that on and it just builds up your cutlery if you've got difficulties with grip. Why not put some potatoes in a chip basket, and it saves you pouring the potatoes. That might be an idea for you rather than straining your wrists and your hands trying to pour vegetables or things like that. And there's lots of great little gadgets on the market, like jar openers like the one here, and green stuff called Dyson matting. That's kind of like non-slip matting, and it's great for just letting the gadget lets the air into the jar, and then the green stuff helps you get the lid off as well, and it saves the jar moving about. So these are just some self-management tips from an occupational therapy point of view. Lots of great stuff on YouTube. So I'll close with that. Thanks very much.
Thank you very much, Janet, and to Trudi as well. I mean, I'm quite sure there will be a load of people out there who are saying, I think I might move to Fife. It's a fantastic service that you offer for patients, and it's really providing that individualized, personalized care and not treating everybody like they're all the same sort of thing. So I just wish that, you know, every hospital was able to offer this kind of service. Sadly, the majority of hospitals and rheumatology units don't have somebody like Trudi, who is a clinical psychologist. You know, we've said many times, it would be great to get much more talking therapies available, psychology services and counselling available for people, because as Janet said, it's depression and anxiety are high, particularly amongst people who are in that early stage of diagnosis and where things aren't under control yet, and so on. So that was really interesting. Thank you. This recording will be able to be watched back by people after this event. If you've missed it, we'll be sending links out, and it'll be available in a few days' time on our Facebook Live, on our Facebook area of the website to watch back after the event. So don't worry if you've missed it, you will be able to catch it. So let's have a look at some of the questions that have come in prior to the Facebook Live this evening. We've had a Slido up for a while, so we've got a few questions here. Let me take these in just in the order that they've come in. Can you have a talk? This is a question to us, I think. Can you have a talk from a functional medical doctor sometime in the future? I do believe diet plays a massive part in reducing inflammation. not sure what a functional medical doctor means in this context, but in regard to diet, I wish it was as easy as if to say, you know, there's this particular diet that is absolutely great for rheumatoid arthritis. The evidence is weak, and we did look at all the evidence when we were doing the NICE guideline in rheumatoid arthritis, and there is some evidence that a Mediterranean style diet has some beneficial impact, but certainly eating a good balanced diet with all the food groups, lots of fresh fruit and vegetables, and kind of minimizing things like the cakes and the biscuits and the chocolate, the sweets and the things that we know are bad for us, but use them as treats to reward yourself when you need a reward. But just eating a good balanced diet is probably the best thing that you can do. Would you agree, guys?
Yes, definitely.
Absolutely.
Ailsa.
Yeah.
Couldn't add to that.
I think if you have a food allergy, or if you've got some kind of foods that upset you, that may also upset your RA. So avoid those foods if you do find that there's something that's not agreeing with you. And lots of people do have food intolerances, but there is no, you can't generalize in terms of food across a whole RA population. Lots of people have said, oh, you know, don't eat tomatoes, or, you know, don't eat oranges, or various things like that. But you can't generalize on things of that nature across a whole RA population. It's a very individual thing.
Mm-hmm.
So on to the next question. Does self-management mean managing on your own or getting less support from your team? Well, I hope that we've been able to cover that during the course of this evening. Absolutely not. Self-management is managing with the support from the right person at the right time, and both Janet and Trudi and I have said that throughout the evening. I do feel sometimes very desperate for people who are not well and who are on their own and whose families are far away from them, and they may not have a good network of people that they can call on. And I find that quite upsetting, because I know how much I rely on my husband and my family and my friends and my colleagues, and being able to call on that support at the right time is so important. So, you know, NRAS helpline is here. We have a 24/7 online peer support community that you can tap into, our NRAS Health Unlocked community, which we support and we moderate and keep safe on a daily basis. And we have our Here For You service, which is using our trained volunteers who have RA. They can provide one-to-one telephone support. So if anybody's feeling particularly, you know, lacking in support, do contact us, and we will help in whatever way we can to put you in touch with others who may be able to provide some telephone or online support. We've got a couple of questions, not really related to self-management, but it's a topical subject on Evusheld, which you may be aware, if you're watching, is a prophylactic drug for people that is not currently available in this country. It's available in other countries, and it can help reduce the chances of people who are very immunosuppressed from getting COVID or being affected badly by COVID. But I can tell you that we have supported general calls to have NICE look at this. They are now going to look at it, but the technology appraisal won't be happening until, I think, March next year. We're talking to the BSR about it. The evidence base, to be honest, is not as good as we would like it to be. And it's not a black and white situation. I believe that it is now being made available privately, but you know, we're not over the moon about that, because there may be some people who might want to pay for it, but for whom it might not be terribly appropriate, and it's a lot of money. and we're in a really difficult time at the moment with the economic crisis and so on. But please be assured we are constantly monitoring the situation. We're talking to the BSR, and we are supporting campaigns with other charities where we feel it's the right thing to do, and we've already done that. So I hope that answers that question. L. Wallace has sent in a question about, is this a multi-agency support, physio, dietitian, etc.? So Janet, do you want to just answer that one?
Yes, I mean, as Ailsa said, we have quite a number of people in our team, but obviously we've got wider contacts within our health and social care partnership as well. But our team consists of doctors, nurses, physios, occupational therapists, psychologists, and a pharmacist, podiatrist. Trudi, have I missed anybody out?
Did we say nursing?
Yes, I think it's nursing.
Admin staff.
Yes, our admin, if we'd be lost without our admin staff, they keep us all, we couldn't do without them. So we started this, I mean, we were quite a new unit in 1994, so we really just were able to start how we wanted to go on. And I think not inheriting traditional ways of working has allowed us to develop this pathway, building on the work that we did, you know, from about 30 years ago when we started as a new unit altogether. So I think that's been quite freeing in terms of doing what we think best for our patients. You know,
you've really done such innovative work, and you know, I truly believe that this kind of thing is as important as taking your meds, because you need to do both. You need to take the medical approach. Yes, I need to take my meds. I need to do the things I've been asked to do, but I also need to do all these other things and help myself and get the support I need from the team. And the two run in parallel. It's not one or the other. It's both.
You're absolutely right. I mean, taking medication is an important part of self-management, absolutely. But it's how you adapt to your condition and how you problem solve and how you take control. And you know, and you may have come with mental health struggles, or you may have come with difficult set of life circumstances when you get diagnosed, and it might be the last straw for you. But you can take control, and you must always have hope in yourself that you can change and that you can cope, and there is support out there from, particularly from NRAS. If you haven't got health professionals or a team like us, NRAS are a fantastic organisation for providing you with the support that you need.
I was just going to say, just can I mention about the multidisciplinary team, you know, that kind of approach. It's, I suppose, it really is holistic, in that, you know, we talked about addressing a sort of biopsychosocial model and assessment. So it really is tapping into people's emotional, psychological, social, physical needs, you know, so whether it's physiotherapy or occupational therapy or psychology. So it really is the whole thing, I suppose, how it affects the person's quality of life in all these different areas. And for some, might not be all these areas, but the support is there, within the team and the skill mix.
Okay, let me squeeze in a couple more questions. I can see there's a question coming from my friend Jackie Pollock, who is a self-management expert. She said, are patients involved in terms of strategic co-production as part of the team developing the pathway?
They are in the sense that we always listen to the patients. So even when we started, when we started the pathway, we piloted it on 32 patients, and we particularly asked for their feedback. So we created this questionnaire, and we had to tweak quite a few things based on some of the things that they said, but overwhelmingly patients were really happy that we were doing this. We also in our rheumatology app, we discussed what with the real need to have a feedback form on the app, getting patients' ideas about the app. So weekly, I get the feedback about the app, and again, we've had lots of great feedback and also very constructive feedback about the app and how it could be improved, and what patients are looking for in terms of information and support. So we try and include patients' views and patients' opinions as much as we can within the way that we design things.
Okay, that's great. Thank you. Sophie Catherine Hurd is saying, are there plans to roll out this approach in other areas? I'm not. I know there are a few units certainly that I'm aware of where they've got psychological support in the team, and they are looking at different things. One unit I've talked to recently, they're trying to develop protocols for nurses, for people who are not doing so well on their treatment or who've gone through a couple of treatments that haven't worked. And that, I know how devastating that can be. And there are, you know, units that we are aware of who do things, but I'm not aware of another unit in the UK that has got such a comprehensive supported self-management pathway right from the get-go. And so unless do you know any different, Janet, Trudi?
No, I mean, I think we're just starting. We did our first talk on this about 6 months ago. Tayside, the unit that is north of us, they have had a talk about this. They were interested to know what we were doing. So we have presented to them, and we are presenting the pathway at the Scottish Society of Rheumatology conference for the first time. So we're at the early stages of delivering this, and we feel confident that the way that we are delivering the pathway is appropriate, that patients are finding it helpful, and that it is a good model, and that other people are now interested in learning a bit more about it.
Mm-hmm. It's all going on in Scotland, you see, guys. We're also doing some other work in Scotland, which will involve more self-management approaches. And I can't say more about it than that at the moment, but yeah, it's all going on north of the border. I just will, we got time maybe for one last question. Please tell me more about the effects or the importance of fermented foods for RA sufferers. I know they're quite popular and fashionable at the moment, but I'm not aware that there is any evidence at all about the benefits of fermented foods in regard to rheumatoid arthritis. So I would say probably if you like it and it's not doing you, you know, you feel good having kimchi or whatever it's called, there's some fermented tea that you can get, then fine. But I would seriously always, if you are going to embark on things outside of your medical treatment, which everybody is free to do, talk to your team. They'll be very happy to tell you whether it's something that might interfere with your medications or whether it's something, yeah, go on, have a go. If you feel it makes your symptoms better, then why not? But I'm going to stop there because we've come to the end of our time. I would just like to promote our Smile RA program, which is our e-learning platform. If you go onto the self-management area of our website, and Anita will put that link up in the chat for you, you'll find more information from me. There's a video about things that I've talked about tonight that I do myself. We've got our various referral services for people living with RA or people newly diagnosed with RA that you can be referred to by your health professionals. We've got our peer support platforms online and one-to-one on the telephone. We've got a brand new booklet that's been out recently called Blood Matters, which is all about the blood test and monitoring. So you can find out more about all of that. All of our things are on the website, free to download, or if you would rather have hard copies, then send us an email to inquiries@nras.org.uk. And next month will be our very last Facebook Live for this year. It will be on the last Wednesday of next month. And I suspect that our chief exec, who's had the night off tonight, Claire, will be back again in front of you for that. And I'm sorry, I can't tell you what the subject is because I don't know. But please do tune in to watch because it's bound to be on something really interesting. I hope you've enjoyed tonight. I'm so grateful to Janet and to Trudi for taking the time out of their busy lives to come and present for us tonight. And I'm very envious of the pathway that you have up there. I hope other hospitals will follow suit and take it up, and they will share this good practice. So thank you both very much indeed. Thank you everybody for watching tonight, and good night. See you again soon.